Hi, I'm Lainey. I'll be your nurse today. Let me get some hand sanitizer. Okay. Can you tell me your name and your date of birth?
Corey Sweeney, October 11th, 2002.
All right, perfect. So today we're going to be doing an assessment on your peripheral vascular system, and I'm going to be listening to your heart. First, I'm going to be looking you up and down, kind of looking at your skin. You look normal for ethnicity. You look pink. It's nice and warm. I can feel the touch. If you look in, there we go, perfect. So I'm gonna just touch your ear and do some just check your pulses. Just sure. This is your carotid pulse, okay. Amplitude is good. It's about 2+, which is normal. Let me do your temporal. Okay, perfect. Now do this side. Okay, good. Still about 2+, which is completely normal. I'm gonna take your blood pressure. Okay. I see your arm. Okay. You just put it this way for me. Okay, just relax your arm or your leg like that. And if you feel uncomfortable, just let me know.
Okay.
Perfect. I got 116/75, which is completely normal. I'm going to be listening right here to your carotid arteries too. I'm going to be listening for any signs of any bruise. Okay, perfect. I don't hear any breathing voices. Okay, next I'm going to be looking at your jugular veins right here and see if there's any type of pulsing. I'm just going to use this flashlight to kind of get. Okay, perfect. I do not notice anything. Okay, perfect. Okay, next, can I see your arms? We're going to look at your upper extremities. We're going to see, like I mentioned earlier, your hair distribution looks good. It looks nice and thick, which is a good sign for good blood flow. Let me see your hands really quick. Perfect. Warm. Okay, your fingers are capillary refill of less than 3 seconds, which is good refill. I'm going to do your skin turgor. Perfect. Elastic. It recoils. There's no signs of tinting. Okay, let me look at your arms right here. I don't see any signs of edema or ulcers or anything in that manner. Is there anything that you have noticed that you are concerned about?
No, ma'am.
Next, I'm going to palpate your brachial and radial pulses for heart rates. I'm going to listen for it as well. Let me see if you could just relax your arm right there. I'm going to do it for 15 seconds. Okay, perfect. Let's see this one right here. Okay, now I'm going to feel it. Okay, right here. Okay, perfect. It was around 80, which is great. We like it usually between 60 and 100. I ask you, I'm going to come in here and see your legs really quick. I'm going to pull your pant legs up. Okay, perfect. So I do this one. Okay, looking at your legs, everything looks fine. A little dry, but nothing unexpected. Good distribution of your hair. You have nice warm legs. Okay. Let me see your skin turgor. Okay, perfect. No tinting. Elastic. Okay, no signs of any ulcers or edema, anything. I'm going to take your socks off really quick. Okay, perfect. Just looking at your toes too. Okay, just looking at your feet too, I don't see any signs of wounds, no ulcers like I had mentioned, no edema in your ankles or anything like that. Good hair distribution. Your toes, capillary refills less than 3 seconds. Your skin is nice and warm on both sides, equal bilaterally, down from your knees all the way down to your ankles from your feet. Okay, you have good signs of some superficial veins, which can also indicate good hydration. Okay, next I'm going to be feeling for your pulses. Okay, I'm going to do right here in your groin if you're comfortable with that. Sure. Okay, perfect. Let me check this out. Okay, we good rate and rhythm, 2+ amplitude. I'm going to check right here for your popliteal, just right behind your kneecap. Sometimes these are a little bit harder to feel. Okay, good amplitude and rate. I'd say about +1 just because those are a little bit more difficult. I want to check your posterior tibial pulses right here on your ankles. Okay, those ones are good. About +2 as well for the amplitude. I'm going to check right here your dorsal pulses. Okay. Okay, those also feel good. 2+ amplitude, which is completely normal. I'm going to be doing your blood pressure in your ankle. We like to do both an upper and lower extremity just to make sure your blood flow is good. There's no artery blockages or anything.
Okay.
So just any one works. Perfect. Okay. Same thing. If at any time you're uncomfortable, just let me know. Okay, just relax your leg for me. I got 130/86, and they're pretty equal. We usually like it to be, in a perfect world, 120/180, but that is good. Next, I'm going to be doing just kind of cardiac assessment. I'm going to be looking at your chest as well, just making sure the framework is great. I'm going to be touching your chest. Okay, good. Your pectoralis muscles, your sternum as well as your ribs. So I'm going to be looking at listening to your apical pulse. It's right here on your left side, mid-clavicular over here, and it's between the 4th and 5th intercostal space. So I'm just going to be touching right here. I'm sorry if it's ticklish. It's usually a slight pulsation that you'll feel, nothing too strong. I want to be listening to it as well. Okay, perfect. Rate and rhythm is good. Just looking at you, I don't notice any type of heaving or any retracting. Do you have any issues breathing or any pain when you are breathing?
No.
Okay, next I'm just going to be listening to your heart again. Okay, perfect. Your heart rate was about 72 is what I had gotten, which I had said earlier. Anything between 60 and 100 was good. I didn't hear any murmurs, no splitting sounds, no extra noises or anything like that. Regular lub-dub noise. I'm going to look in a little bit more to other areas as well. Just make sure I didn't miss anything. Perfect. Everything sounded great. On an EKG, it would show up as a normal sinus rhythm, so everything sounds great. Is there anything that you're worried about?
No.
All right, perfect. Thank you.